Hi, welcome to the Adult Behavioral Health HCBS Provider Update. Nicole, can you move to the agenda slide real quick? I think you have the ball. Okay.
I'm sorry, Andy, I did move it, but I'm just going to try that again for you.
All right.
They need to give me the ball.
Oh, can you give Katie the ball? That will resolve that issue.
Oh, there we go. All right. Okay. So welcome to the Adult Behavioral Health HCBS update. I want to thank everybody for joining the webinar today, particularly on a Friday, and depending on where you are, it's a little rainy outside and dark. Just a couple of housekeeping things, and then we'll run through the agenda, and then we'll dive in. So first of all, this webinar today is focused exclusively on adult behavioral health HCBS services. So if you're a child behavioral health or any kind of child HCBS provider, this webinar. The desktop is somebody is off. Closing doors, please. And there we go. All right, somebody was clearly getting on the train. Okay, this webinar is for adult behavioral health HCBS providers. It is not for children's behavioral health or any other children's HCBS providers. So if you joined to learn about the children's behavioral health HCBS system, there's other content through MCTEC on that, but this webinar is not going to cover that at all. The webinar is being recorded today, and both the slides as well as the webinar recording will be made available on the MCTEC website in the next couple days. Please, over the course of the webinar, use the chat function to chat in your questions. We are going to hold all questions until the end of the webinar, and we'll go through them. But please feel free to chat in your questions along the way, because we're gonna collate all those questions, and then we'll go through them at the end. So no need to kind of like hold it and then try to remember an hour from now what it was that you want to ask. Feel free to just chat it in as it comes. And we do have a lot of state partners on today to be able to cover, a really wide swath of questions. So please feel free to ask all your questions, and we'll do our best to answer them today. Any questions that we can't answer today, we'll take back and with our state partners get back in a kind of FAQ kind of thing as well. And I would also highlight, as with all of these webinars, particularly around policy, the information shared today is accurate as of 12:05 today. But the information could change over time, particularly if you end up watching this, a month from now, but based on the recording. So we're going to go through a little bit of background around the adult HCBS system. We're going to talk about a new overview of the oversight policy, talk about terms and conditions, review the authorization attestation process, go through some of the training requirements, and then really leave some time at the end of the webinar to take Q&A. So I'm glad everybody joined today. And with that, I believe I'm going to pass this on to Nicole Haggerty.
Yes, good afternoon, everyone. My name is Nicole Haggerty. I'm at the New York State Office of Mental Health, and I'm here today with my OASIS and OMH colleagues to outline a very important update for all adult behavioral health HCBS providers. Just to reiterate, as Andy noted, this is directed to adult behavioral health HCBS providers only, and those services are specific to enrollees of the Medicaid Managed Care HARP, or Health and Recovery Plans. So to give a bit of background, New York State started to designate adult behavioral health HCBS providers in 2014. Since that time, the state has worked together to provide oversight and technical assistance as needed. This oversight policy will provide a framework moving forward. As HCBS are paid through Medicaid Managed Care, providers must meet certain requirements and comply with state and federal regulations, and we'll outline those today. Most designated providers have previously provided Medicaid service and may be familiar with these requirements and regulations. So the terms and conditions are intended to clarify requirements for all designated HCBS providers. We'll also discuss the authorization attestation process, which will be required for each designated provider to affirm their compliance and understanding of the terms and conditions. So I'll begin with the oversight policy. As referenced, the New York State Oversight and Monitoring Policy and Framework will be outlined thoroughly in the guidance document. The guidance document will be included and sent out to all provider agencies of HCBS individually. We'll also email this on our listserv, and we will eventually post this on the OMH website. Within the policy, you will see a framework including site visits and using a forthcoming standards of care tool. Thank you, guys. It will also talk about statement of deficiencies and the submissions and process for plans of corrective action for concerns around HCBS. And today I'll touch on the process of suspension of an HCBS provider's designation, the termination of designation, and the withdrawal of a designation.
If you're one of our presenters and your phone is not on mute, please mute it. And Jocelyn, if you notice that that there's sound coming from anybody else but Nicole when she's talking in the panelists, you can just mute their phone. That'd be fantastic.
Thanks so much, Andy. So designation to provide HCBS is a separate process from licensing or certifying programs. These licensed or certified agencies have their own state-governed regulations. All providers are subject to oversight in order to maintain their standing as an HCBS designated provider. To ease some of the administrative burdens on agencies, however, for providers who are licensed or certified through OMH or ACES, the state will attempt to include the oversight of HCBS into those processes and procedures. For all providers, routine site visits will be conducted at a minimum of once every 36 months. A standards of care tool will be used to ensure that designated providers are meeting all requirements in the provider manual, the terms and conditions that we'll outline today, and any other applicable state guidance documents. When deficiencies are found, a statement of deficiency will be issued and the provider will be expected to submit a plan of corrective action. Again, the policy itself will go a little further into each of these pieces. These are just parts that we're outlining today for you. Sanctions. Deficiencies may result in the application of sanctions. These sanctions may include suspension of designation, where a provider would cease new admissions while taking corrective action. It may also include termination of designation, where a provider must cease taking new admissions and begin to discharge and transition plan for current members. There will also be an outline for a process of withdrawing designation. A provider may choose to voluntarily withdraw their designation status for any reason, including a lack of capacity or expertise to provide the service at a given time. If the state becomes aware that a provider is unable to actively deliver a service as attested to, they will contact the provider in writing to request the current status of that service and a plan to become active or begin to withdraw their designation. Okay. I am now going to turn it over to Katie Merrill here at OMH to review the terms and conditions policy.
Hi, this is Katie. The Terms and Conditions for Adult BH HCBS Providers is a document that will walk you through the terms and conditions that will apply to maintain your designation status. And most of this is not going to be new for providers who have been in Medicaid services previously. A lot of this has already been articulated in other policy documents, like the policy paper posted on our website, in the provider manual, and in the billing manual. But we wanted to bring these together into a single document so that you could review your compliance with the existing regulations and make sure that you're meeting all state and federal requirements for HCBS. The Terms and Conditions memo is going to be sent out to all currently designated providers who are in active status, which is just about everyone aside from a few crisis respite providers. I'm going to walk you through each term and condition and tell you a little bit about what that means. So the first one under state and federal regulations is that providers who are already enrolled Medicaid providers need to maintain their standing as such. So this would be if you operate any of our licensed or certified Medicaid programs like an ACT team, a PROS program, a clinic, an OASAS certified clinic or residence, then you would already be an enrolled Medicaid provider and you need to maintain that standing. At this time, Adult Behavioral Health HCBS is not an enrollable provider type in eMedNY. We're working with the Department of Health to make it one. And at that time that it becomes an enrollable provider type, you will be required to become a Medicaid enrolled provider if you're not already. We will notify you when that becomes possible. We'll send out an announcement on our listserv, and we'll make sure that everyone is aware of that when it's possible. The next term and condition is that the provider needs to ensure all staff working in the Adult Behavioral Health HCBS program are not disbarred or excluded from the federal health care programs. So that would be Medicaid and Medicare. You need to make sure that they've not been convicted of a criminal offense in relation to the provision of health care services, and that they're not under investigation for such an offense. This is pretty standard as far as Medicaid programs go. This is probably something that you're already doing upon hiring new employees, but we wanted to make sure that everyone was aware of this under federal law. The next term and condition is related. It talks about the required pre-employment checks, or background checks as they're sometimes referred to, and this is articulated in the 2015 policy paper that's posted on our website. There are certain pre-employment checks that are needed for anyone who's going to be providing direct services under HCBS. That is the Justice Center's criminal background check system, the staff exclusion list, and the child abuse registry. You should be aware that for the child abuse registry, if you're going to send someone through that background check, it can take several weeks to complete. So as far as pre-employment goes, that individual would need to work under supervision if they were providing services prior to getting that clearance. The next term and condition has to do with confidentiality and protecting the health history of individuals with HIV/AIDS, and that also relates to any testing for HIV/AIDS regardless of their status. Again, for providers who have existing compliance programs, who have worked with this population, this should not be a surprise. You likely already have policies and procedures that address this and that safeguard that information. The next term and condition, again, safeguarding confidentiality of information as Medicaid services with access to protected health information, anything regarding HARP recipients and HCBS recipients would be subject to HIPAA. And so we do expect that you would have policies and procedures in place and protocols and systems that will protect the protected health information of HARP members, and that staff would receive training around this to make sure that there are no unnecessary disclosures or inappropriate disclosures. Next, we have compliance with the CMS final rule. This is something that we've talked a lot about in New York State. The final rule has implications for the setting where people live as well as the setting where people receive services. We expect that all adult HCBS providers, whether or not they are a residential provider, have familiarity with the final rule and that they ensure that the settings where they are providing services are compliant. Now, your health home care managers and recovery coordinators are going to assist with making sure that you get appropriate referrals. So someone who resides in a community residence would not be referred to HCBS, but it's also important to make sure that where you're providing services is in a home and community-based setting, not an institutional setting. We have guidance out to help you figure out which of OMH's licensed and funded residential settings is appropriate for HCBS. There was a letter dated August 2016, and that remains in effect. There's also a lot of information on the CMS website and additional guidance regarding this requirement. So there's a link here and at the end of this webinar to give you more information. Nothing about being a designated provider would replace or supersede other licensure requirements for your individual staff. Each staff person needs to act within their scope of practice according to New York State educational licensing requirements. So a licensed master of social work would still function within that LMSW scope of practice. Same for a licensed mental health counselor. Similar for paraprofessional staff, a peer support staff would be expected to function within their scope of practice. Providers are expected to comply with the Adult Behavioral Health HCBS Provider Manual and any updates that are made to that manual. It hasn't been updated in a couple of years, but when there are revisions, we will certainly put that out via our listserv so that all providers are aware. And you are expected to meet all of the service requirements that are listed in the document. Providers are also expected to comply with the New York State HARP and Mainstream Behavioral Health Billing and Coding Manual. The Billing and Coding Manual actually has quite a few programmatic implications that includes things like the utilization threshold for HCBS, which puts a dollar limit based on an individual's tier. There are also caps in terms of the number of units per day an individual may receive, and it walks you through the co-enrollment restrictions for state plan services. So if someone is receiving clinical treatment services through ACT or WASAS, if they are residing in one of our residences or receiving services through PROS or ACT, it'll tell you which HCBS they are eligible to receive, and so we expect that all HCBS providers would be aware of that. Lastly, as far as the policy manuals and guidance, we have the workflow guidance, and this is something that is often thought of as a health home or recovery coordination document. But there are specific requirements for HCBS providers in the workflow, and it's important that you comply with those requirements. For example, upon receipt of a level of service determination from a care manager, recovery coordinator, or MCO, the HCBS provider is responsible for notifying the MCO that they've received that referral and that they have scheduled the intake and evaluation. Any updates made to any of those three documents, the workflow, the provider manual, or the HARP billing manual, will be subject to these terms and conditions. Part of the terms and conditions is also acknowledging that OMH, OASAS, DOH, and the LGUs may conduct audits or inspections of the provider. This is outlined in our oversight policy, which will be released following this webinar. That will be done using a standards of care tool, which will be issued at a future date. However, upon complaint or concern, we may also look at other items outside from the standards of care. So we have the right to inspect any books or records, including member records, your EHR, paper charts. We can interview staff or HARP members, and any other documents that we request. You will also participate in any evaluation or monitoring activities at the request of OMH, OASAS, and CMS. This has to do with the fact that these are HCBS services authorized under the Center for Medicaid and Medicare Services. So if we ask you to participate in any evaluation activities, then that would be expected. Via the authorization attestation, we are asking you to attest that you have developed or amended certain policies and procedures within your organization as they relate to adult behavioral health HCBS. Most agencies likely have an existing policy and procedure manual. This is something that consists of clear and concise policy statements along with procedures and protocols that describe how staff should respond to various situations. Agencies will may need to develop new policies and procedures or revise their current ones to align with current state and federal policy for adult BH HCBS, and we are available to provide technical assistance around this. The specific policies and procedures that you will be required to have include one for intake, including the referral process and completion of the service-specific evaluation, one for discharge, including the process for transferring a member to another service provider or level of care, communication and collaboration with the health home care manager, recovery coordinator, and other collaterals as appropriate. That may include family members based on the member's preference. It would also include the managed care organization and any care managers or utilization managers at the MCO. You need to have a policy and procedure around service planning and development of the individualized service plan, documentation of services provided, and that would include the completion of service encounter notes as defined in the provider manual. You also need to have a policy and procedure around crisis and emergency response for HCBS recipients. You need to have a policy and procedure for compliance with all applicable requirements of state and federal regs. This might be your corporate compliance plan if you're a larger provider that has one in place. You also need to have a policy and procedure for quality improvement and utilization review. This is going to be particularly important around managing that utilization threshold that applies to all HCBS as outlined in the billing manual. You should have an internal policy and procedure for incident reporting and review, for record retention specific to the provision of services, and for staff training and workforce development. You also need to have a policy and procedure for community safety of staff and participants, confidentiality and disclosure of member records in accordance with state and federal laws. So this is where you might speak to your protocols around HIPAA and the protection of HIV/AIDS information. A policy and procedure for verification of employment history, personal references, work records, and qualifications, as well as criminal history record checks of employees. And lastly, you need to have a policy and procedure that includes a grievance process for service recipients, which ensures a timely review and resolution of any recipient complaints, and which provides a process that enables recipients to request review by the state when resolution is not satisfactory. As a provider, you must have a compliance officer or other administrative structure available to process and address grievances or recipient complaints. Again, we're available to provide technical assistance around policies and procedures. We will not be approving any internal policies and procedures, but for agencies to whom this might be a newer process or who require some significant revisions to account for adult HCBS within their agencies, we're happy to take a look and make recommendations or to brainstorm ideas with you. The provider needs to attest via the authorization attestation that your organization has mechanisms that promote the competency of your workforce. This includes registration in the CPI, or Center for Practice Innovation, Learning Management System. That's known as the Learning Community. We've sent out a lot of information regarding this, and I believe CPI has reached out to all HCBS providers to help them enroll. If you have not yet registered with this system, you are required to do so. There are required training modules, which we will speak to later in this presentation, and there are required timeframes around completion. So it's very important that you are registered in that system. The provider must complete an annual consolidated fiscal report and must report these services, HCBS, under the appropriate program code. So CFRs are required for all OMH and OASAS providers. If you do not have any expenses or revenue related to adult HCBS in a given year, then you would put 0 on your CFR. But if you have any expenses or any revenues from HCBS, then you are expected to complete the CFR. There is a lot of information in both the OMH and OASAS websites, and you can also look at the CFR transmittal letter, manual, and appendices for more information on how to complete the form. To complete the CFR, you would need to be established in our interagency system by completing an agency contact form. Completion of this form allows you to obtain an agency code and user ID, so if you have not already done so, please contact the Bureau of Rehab Services and Care Coordination here at OMH. You can also contact OASAS to receive a copy of the form, and our contact information is at the end of this presentation. The next section of the terms and conditions has to do with your designation status, and the first one is really important. The provider will notify OMH and OASAS of any material changes in the disclosures set forth in your application for designation. This could include, but is not limited to, a change in your CEO or primary contact for adult HCBS, or a change in your sites or addresses. This includes your administrative site. It includes the sites where you provide services. If you're looking to expand to additional counties or boroughs in New York City, if you're looking to add other services, or if you've had a significant change in your staffing. For example, if you put on the application that you would have an LCSW supervising services, but that individual is never hired or has moved to a different department, then you need to notify us of who is now supervising the services. Also, sole practitioners and group practices are only eligible for designation if you are able to meet and attest to all terms and conditions outlined herein. So these terms and conditions apply to anyone who is actively designated, regardless of their organizational structure. Your designation may be withdrawn at any time upon mutual consent of OMH, OASAS, and the provider. The process for withdrawing designation is outlined in the oversight policy. It is something that has been in place for quite some time on an as-needed basis. So from time to time, providers will discover that there simply aren't enough referrals to continue with a specific service, or perhaps they've had changes in staffing that mean they no longer have the expertise to provide that service, and they may choose to withdraw their designation. That's a voluntary process. It can also be initiated if OMH or OASAS receives concerns from MCOs or care managers about a provider who's not accepting referrals. We would reach out to you, we would assess the situation, work with you to determine if you want to remain an active provider, and if not, we can simply withdraw the designation, which is not a punitive process. The state's oversight policy, which again we talked about earlier in this presentation, includes our right to terminate a provider's designation. You will receive written notice of the termination, and this could be because you've failed to comply with the terms and conditions of being an adult HCBS provider, or with any other laws, rules, regulations, policies, and procedures that would apply. Also, if there's a significant risk to participant health and safety, if a member is injured or is neglected and there is fault on the provider, we might move to terminate designation at that point. Any allegations of abuse or neglect we take very seriously, and it would be handled on a case-by-case basis. In no event shall the state be held liable for expenses or obligations that arise after the date of your termination. So if you have your termination status terminated and you have expenses or costs related to staffing after that time or any other program expenses, the state is not liable for that. And that's the end of the terms and conditions. This PowerPoint has consisted pretty much word for word of the document that you will see that we're going to email out to you. We wanted to get this to you in advance so that you could see what we are going to be asking you to attest to. I'll talk briefly about the authorization attestation process. Each designated provider will receive a copy of the terms and conditions memo and a blank authorization attestation via email to the primary contact listed for adult HCBS. So that's the primary contact that you would see listed on the designation list and in your application. We're also going to send it to the executive director who we have listed on file. Now we understand that that may not be up to date because we have the CEO who signed the application back in 2014 or 2015. We're going to do our best to get it to your current leadership, and we ask that if you're the primary contact and there's been a change in leadership, that you let us know as soon as possible so that we can get this to the right person. The authorization attestation will ask you to affirm compliance with the terms and conditions for adult HCBS, as it is necessary to maintain your authorization to provide these services. It must be signed by the executive director or an authorized designee. So this is someone who the executive director has given approval to sign in their place. It must be submitted to the state within 60 days. The deadline will depend on the date that you receive the terms and conditions. We are hoping to get these out to each individual agency by the end of next week. So your due date would likely be June 3rd or June 4th, depending on the date that you receive the letter. You can scan and submit it via email to adulthcbs@omh.ny.gov. And failure to submit the terms and conditions authorization attestation may result in a termination of your designation. This is what the authorization attestation looks like. It's a very simple form. We just ask for your agency name, the printed name and signature and title of the individual completing the attestation, and the date. We have a statement there that you have read the document, that you understand the terms and conditions, and that you will abide by all applicable laws, reporting requirements, and policies. Now, the authorization attestation is going to go out to all active providers. There are short-term crisis respite providers and intensive crisis providers who remain on hiatus status. These are the only service providers who can remain on hiatus at this time. As many of you will recall, a couple of years ago, we went through a process in the summer of 2017 to remove providers who were on hiatus and could not go into active status. We made an exception for short-term crisis respite and intensive crisis respite, and so there are a few who remain on hiatus. Those providers will not need to submit the authorization attestation until they are ready to actively provide the services. If you have short-term crisis respite or intensive crisis respite on hiatus but other services active, then you need to submit the authorization attestation for the services that are active. And we would talk to you further about meeting those requirements for respite at the time that you choose to go active for respite. If for any other reason you are unable to attest to compliance with the terms and conditions within 60 days, you must contact the state with your specific concerns prior to the deadline for submission. To do so, you will send us an email at adultbhhcbs@omh.ny.gov. You must include your specific questions or concerns and tell us which term and condition you are unable to comply with. So each one is numbered and lettered, and you need to tell us specifically where you are having trouble with compliance so that we can provide targeted technical assistance and help you come into compliance. All right, and I'm going to turn it over to Liam McNabb to talk about those training requirements.
Thanks, Katie. Hi, this is Liam. I'm going to talk about required training for all HCBS provider employees. That includes supervisors and direct care staff. Our training has been broken down into 3 sections, which include the core knowledge areas, the overview of HARP, the Health and Recovery Plan, HCBS, and HCBS service-specific trainings, which I'll talk more about. And they're all available in the Learning Management System, which is available through the Center for Practice Innovations, the CPI LMS system. Access to the LMS has been granted to one agency contact for each of your organizations. And as of today, most HCBS organizations have been given access or enrolled in their system and have access to some of these trainings that have been available through CPI already. And if your agency supervisor has not been contacted, contact our email address there on the screen for further information, and we can facilitate access for you. So we'll be sending out a memo shortly to provide more of this information and to support the fact that these trainings are required. The core knowledge areas are required for current staff. Once again, that includes supervisors. Need to be completed within 90 days of the date of the memo, and for new staff, need to be completed within 60 days of the date of hire. And a couple examples of the training included with the core knowledge areas are motivational interviewing, person-centered planning, and trauma-informed approaches. For overview of HARP and HCBS, once again, the time frames are the same, 90 days from the date of when the memo is issued and 60 days for the date of the hire of new staff. And for HCBS service-specific training, these are brief modules that will feature experienced HCBS providers who will share their experience delivering each of these services. For example, psychosocial rehabilitation, what that service may look like, as well as some examples of participants who have benefited from the many ways that service could be delivered, or intensive supported employment, and so on. And the time frames for those HCBS service-specific training are consistent with the time frames above. And what's important to note about these trainings is these are what we think valuable resources for you and your staff to better prepare you to deliver these services to the participants you serve in the most effective way possible. And we're going to continue to develop more in-depth training moving forward, and we'll engage many of you and your organizations moving forward to make sure that you have as many resources as possible. So we hope that you'll find these helpful.
Okay. Thank you, Liam. Okay, Andy, I think we're all set.
Fantastic, fantastic. So I am going to start to highlight the questions that have come in as we've gone forward. So I would just like to say to everybody on the webinar, we have a number of questions that have come in so far. If you have other questions, please chat them in using the chat box, and we will get to as many of them as we can before we get to the end of the webinar. So just give me 1 second to look at the questions that have come in so far, and then we will dive right in. So, where can I find the rules rounding up or down for services, i.e. pre-vocational? I found them for community have 15-minute increments, but not for other services.
I think we were just talking in the room here that particular question we won't address here in the terms and condition. I think it points to the billing manual policy, and so we would redirect you to the billing manual and its current status, and what the requirements are relative to rounding up or not would be reflected in the billing manual.
All right, fantastic, thank you. Can a provider just remove a particular service if they want to, I guess the technical term I'm going to get wrong, but undesignate, or do they have to completely give up their designation process?
You can choose to withdraw for a specific service or even for a specific site or county if you don't have the expertise or the staffing to provide in that county, location, or for that service. So, for example, we have a lot of providers who may have applied to provide all of the services, but then based on demand, we're only able to sustain peer support or psychosocial rehab, and so they have withdrawn their designation for certain services and kept it for others.
Okay, fantastic. And then who will be attending the site visits?
It would be OMH and or OASIS staff. Okay,
great. And then is the recertification process a tiered process or automatic 36 months?
Could you repeat that, Andy?
Yeah, is the recertification process a tiered process or an automatic 36-month recertification?
Yeah, I think it sounds like a reference to our current licensing policy. So the oversight policy will be different. For designated HCBS providers, the key point here is that we'll be, if a provider is licensed and or otherwise certified by OMH, what we will attempt to do for efficiency's sake is to roll up their HCBS services within that oversight and technical assistance visit, and then further detail from there to come.
Okay. So I'm going to combine two questions because they're both very similar. First of all, is it a requirement that we complete the Child Abuse Registry background check on all HCBS staff?
It's OMH Council's opinion that yes, the SCR should be completed on all staff that have that requisite level of contact in working with children and adults.
Okay. And then if I'm an HCBS provider not connected to an OASIS or OMH program, how do I meet the pre-employment checks?
We will send out an email to all HCBS designated providers to make sure that they have all of the forms necessary to access all of those systems.
Okay. And then does each staff member providing HCBS services have to need, sorry, let me just start over with that. Does each staff member providing HCBS services need an individual MPI number?
Yeah, so I will confirm here and follow up on that one, but there's separate policy not included here in the terms and conditions that are relative to managed care, but I believe it's each individual provider requires an MPI number. When we follow up with an FAQ, we will include that to clarify.
All right, great.
And Nicole, this is Tricia at Oasis. I do think that we have to look at that and clarify in a follow-up question, because there are some circumstances where I think we call it unlicensed practitioner NPIs can be used. So we should look at that.
Thank you.
Yep.
All right. If we're a provider of OMH and or OASIS services and we are already enrolled in the CFR, do we need to do anything additional to any additional enrollment for HCBS?
You'll still file the CFR in the same way that you did. You just need to make sure that your programs are all entered into MHPD, whatever you're designated for.
For the
Right.
for the OMH host for the OMH providers.
With all the added requirements, is there any increase in rates anticipated?
None of these requirements are new for adult BHHCBS. These have always been Medicaid-funded services through the managed care plans, and so they have always been subject to these regulations. We recognize that some providers may have been unaware, particularly those who are new to Medicaid, but none of these requirements are new for adult BHHCBS, and there will not be an increase in rates as a result.
All right, thank you. We already submitted an attestation back when adult HCBS was implemented. Does it need to be done again?
Totally separate attestation.
Okay, I was looking around the room for the attestation. So to be clear, this attestation is would be completely separate than the original attestation that you may have made when you applied to be an HCBS provider, and you filled out a form that included details about your staffing and your level of competency in order to provide the services, and you attested to that. That was your original designation. There's also an attestation process that happened, as Katie said, in summer of 2017, when we got rid of the hiatus status for everyone but the crisis respite providers, so that agencies who were already designated attested that they were able to actively receive referrals, that they had contract with MCOs, and they had staff to provide the services. So that was a separate attestation process. And this attestation process is that you have received these terms and conditions, that you understand them, and you agree to employ all of those conditions as a result of your designation as an HCBS provider.
Okay, great. And then another follow-up question to that. Do all the policies and procedures specified in the terms and conditions have to be developed in order to sign the attestation?
Yes, they should all be developed. Again, we made sure to indicate in the beginning that you may not need to create new processes and procedures for HCBS. Many agencies will already have policies and procedures to protect confidentiality and HIPAA, so they do not need to be created separately or made up individually for HCBS. Some of the policies and procedures will point directly to these services. For example, the way that you would communicate with a health home care manager, or the process of documentation relative to a service plan. Those policies and procedures should be created. You're attesting to the fact that you understand you need to have them and that you do have them, which is also why Katie emphasized if any providers have questions about each of those policies and procedures. We went through quite a few today that are not intuitive, or folks have trouble understanding what we're asking. Please reach out to us immediately. You don't have to not attest, and you don't have to say you can't make it. We can certainly help you to come into compliance, but not hearing anything back from agencies is not acceptable. We need to know one way or another where you are with this, and as Katie said, have very pointed, targeted outreach and intervention relative to which terms and conditions that you're struggling with so that we can address it immediately. We have about 300 providers, so we're trying to do this in the most efficient way. And again, we anticipate most of these things are fairly intuitive or already exist, but we also want to be helpful as you start to move along and review the document.
All right, so your message to folks is if they're having problems coming into compliance with one of these things, they really should start talking to you quickly and soon so that they and you can work together to address the issues.
Exactly. Thank you, Andy.
Great. Is Medicaid provider enrollment required for HCBS?
It's required for everyone. It's a federal regulation under the Cures Act that was put into effect in 2016. That anyone who deals with or works with Medicaid recipients needs to become a Medicaid enrolled provider. And one of the slides had mentioned that we are working on that now to work with DOH and MedNeed to get to try and get people enrolled.
Yes.
Okay, great.
Right, for agencies that are not already enrolled, there will be in the future an actual provider type called Adult Behavioral Health, HCBS, or something that would be tailored to these services for providers that are not already within the MedNeed system.
I would just add that if you are not a Medicaid enrolled provider today because you are ineligible to be one, you can still attest. What will happen is just that when the application becomes available, you will need to submit that application and become a Medicaid enrolled provider. If you have your Medicaid enrollment status already because you operate other Medicaid services or programs, then you just need to maintain that status.
Okay, that's great. And then the other question that came up a little bit different is there a reason why individuals with Medicare coverage, dual coverage, are not eligible for HCBS services?
Is there a reason why Medicaid managed care folks, can you say that one more time, Andy?
So the question is basically why are dually eligible individuals, Medicaid and Medicare, ineligible for HCBS services?
Okay.
I can answer that.
Oh, go ahead, Trish. Go ahead.
I think it's easy. It's because they're not enrolled in the HARP plan, right? They're not eligible duals to be enrolled in that HARP, so they can't get HCBS services. Yep.
There we go. All right. And then could you please review the process for updating staff info? I think you did it during the webinar, but I think some people had some questions around that.
If you've had a significant change in staffing, particularly in the qualifications of who is providing or supervising these services, you would need to update your application. You can do that by contacting the Adult BH HCBS mailbox and letting us know that you have updates. Depending on how major of a revision is needed, we may be able to make that update for you. For example, if you expected to have an LCSW supervising but you have an LMSW, that's something we can make very easily. If you have significant changes in the staffing for all of your services, then we would ask that you go into the application. So we'll provide you instructions when you email us.
Great. And then if an agency hasn't started, I'm assuming they're designated, if an agency hasn't started providing the services yet, is there somebody they can contact on getting started with actually providing services?
So this webinar is addressed to just the existing designated HCBS providers. So the terms and conditions would only be applicable to those that are currently designated.
Okay, there we go. And then can you just point people back to, I think you did in the webinar, the best places to look to find the inappropriate settings for delivering services?
So there's the CMS website, which provides a lot of guidance around all elements of the final rule, including the excluded settings and person-centered planning requirements. OMH also sent out a letter in 2016 regarding our licensed and funded residential settings, and if you need a copy of that letter, you can email us and we will send it to you. Other guidance, I would refer you to the CMS website.
Okay. Will there be someone available for technical assistance for help with implementation as we go forward? So I don't know if you want me to take that or you want to take that yourselves.
Sorry, Andy, go ahead.
Yeah, so we're working with CPI and NIAPRIS and the Center on Addiction and have a whole comprehensive set of technical assistance offerings, and there's more technical assistance offerings to come directly related to adult HCBS behavioral health services. So just stay tuned to those MCTAC emails, and we will provide additional technical assistance updates. All right, does this program fall within the Justice Center guidelines?
No, they don't fall within the Justice Center because they are not otherwise licensed programs.
Okay. So we are nearing the end of the questions. So if anybody has any additional questions, now would be the time to send them in, and Jocelyn will update the Q&A list. I think we have another 10 minutes or so. Okay. Plans have started recredentialing cycles that are scheduled to include HCBS providers to get corrected information collected for directories and designation. And this regular cadence is every 3 years. Can you advise how this process is to interact with the plan's recredentialing process? So I think what they're asking is how your process for oversight is interacting with potentially the plan's credentialing process.
I think we will be, well, first of all, designation is the state's role in identifying providers. And then, of course, managed care organizations have contracted relationships with each providers and expectations as a result of those contracts. So the state will continue to, as we do now, work closely with the managed care organizations to make sure that our efforts directly align with theirs whenever possible.
Okay. And then if my staff is taking a motivational interviewing training, I guess this could apply to any training, required by the agency, do they also still need to take the CPI version of that training?
Yeah, I think that's a good question, and because the requirements are fairly new and we're working off of the LMS system, the original intention is for it to, those trainings to directly relate to that system, but I think that is something we can discuss a bit further and follow up on in an FAQ. We may even be able to get that out in the actual memo to clarify one way or another and be more clear about that.
That'd be fantastic. All right, I think we have reached the end of the questions. So if I'm going to give people another minute, if there's any other questions, then we will ask them. And then the other question is, are these trainings required for HCBS employees?
Yes, the memo will outline much more detail about the required trainings, but all HCBS providers will be required to have these trainings.
Okay, great.
Andy, we saw a couple of raised hands via the WebEx. I don't know if that's something we're able to access.
Yeah, we don't usually do that, and then we've actually gotten a number of other questions. So I'm just going to take 1 second and let Jocelyn move them over, and then, because I don't want to be double dipping. And then once she's done that, I'll ask a couple other questions as well. So if you did raise your hand, please, and you have a question, please chat it into the chat box, and we'll get to it. Okay. Does new staff need to be checked against the Justice Center's exclusion list?
Yes, that is a mandatory requirement prior to doing fingerprinting and requesting a criminal background check, that the SEL is checked prior to. Okay,
great. And I assume this is a more general question. If people have additional issues around HCBS, who should they be reaching out to? Is there a specific OMH and OASS point of contact person they should be reaching out to?
On the WebEx, I have the 2 mailboxes that would be best points of contact.
Right there on the slide that's actually up, Nicole.
It's there. It's ready.
There we go. Fantastic. And then should fingerprinting be done through OMH I assume OMH, OASAS, or through the HCS DOH?
For these programs, you would not be using the HCS system or the CHRC. This is a CBC requirement from OMH and OASIS. We do not waiver with DOH and their criminal history record check. So depending on which is your oversight agency that you will background check through is how you'll do those going forward.
And that specific information in terms of each provider and the host agency or the oversight agency will be indicated on your individual provider letters that you'll be receiving within the next week. It will tell you your host agency, and that will also be applicable to your CFR reporting. It will be the same agency.
Okay, great. And then for very small providers who don't meet the $500,000 threshold in Medicaid revenue, with regard to compliance, is the compliance policy adequate enough, or is it necessary to create a corporate compliance plan?
The compliance policy is enough.
Is enough. Okay, great.
Yeah.
And then how much notice will HCBS providers receive before their site visits?
We can do site visits at any time, and in fact, we already have done site visits for HCBS providers in a very targeted way. And so we can come in and look at your books, your case records. We can talk to clients at any point in time. We do not anticipate giving notice prior to site reviews.
Okay, there we go. And then can we use the CPI for all our agency staff members, or is registration limited to our HCBS staff? The CPI is, I'm just going to take this and you guys can add in if there's anything missing. CPI is a technical assistance center that's available to all OMH providers, and so you can take advantage of them for all staff. And then if you haven't completed the trainings yet, are we out of compliance already?
So the training memo and a little bit about what Liam went back to, let me see if I can get back to it quick here because it's right there. So upon the date of the memo going out, your current staff will have 90 days to complete the training, and any newly hired staff will have 60 days from the date of hire, and that means hire for that HCBS service.
Okay, great. So if somebody's transferred in from another program, they'd have 60 days from that date as well.
Yeah, and you know what, it should be clarified also that this memo will come out possibly separate from the terms and conditions. So you're not attesting that you've completed the training. The training memo and requirements kind of live outside of the terms and conditions attestation. I think that's an important point to make so that people don't feel like they're on the clock at the same time that they need to attest to the policies and procedures and these Medicaid terms and conditions, that training memo will come out separately. You'll have a date on it. You'll be able to have some time to register in the SMLS, et cetera, and that will be a separate process.
Okay. So we have gotten to the end of our questions. I just looked over in the chat box, and there are no more questions there either. So unless there's anything else on you guys' end, I'd like to thank everybody for taking the time to join on a Friday afternoon, and also thank all of our state partners for joining today to provide this information, and Jocelyn at CCSI for coordinating all of the questions in the background in a way that made sense for everybody. So anything else on you guys' end?
I would just add that throughout the terms and conditions document, there are links to several different manuals and guidance documents. And so we've provided those resources here. If you're sitting in your office, you might want to screenshot this slide. We will get the slides out through MCTAC as well. And when you receive the terms and conditions, everything will be linked in that document. But if you want to get a head start on reviewing these guidance documents and policies, here are the websites that we've provided to help you out.
Great. And we'll get these slides out and the webinar online next week as well for people.
Thank you, Andy. One more thing from us.
I also want to mention that on May 16th, if people want to mark their calendars, from 1 to 3, I have the Justice Center's Criminal Background Check Unit Director providing a WebEx to our authorized person community out there. Some of you are not yet authorized persons, so you will not receive the notice until you designate somebody as an authorized person for your agency. But as soon as as soon as a designated authorized person is named for your agency, I will send out an email and notify you of the WebEx address. But just mark your calendars for now that it's May 16th from 1 to 3 if you'd like to join that.
Great, and if it's appropriate, we're glad to push that out through our MCTAC services as well.
Great, thank you.
All right, you're welcome. All right, very good. Well, thank you everybody for taking the time to join today, and I hope everybody has a nice weekend.
Thank you.
Thank you.
Thank you.
All right, take care.